Low-income families in HCMC hardest hit by COVID. The Delta variant has uprooted the daily life in COVID-19 hotspot HCMC, causing hardship, despair, and food shortages. For more than a month, wild sweet potatoes and some random vegetables from a wasteland next to his inn have saved Truong Van Phi and his wife. At the end of a zigzag alley in Vinh Loc A Commune, Binh Chanh District, Phi strained his eyes to spot a few more leaves ripe enough to cook a bowl of soup. He and his wife haven't been able to earn money for over a month. Using their small savings from before the city entered semi-lockdown, the couple bought a kilogram of pork, which they have been using to feed their 9-year-old son. Half a month ago, my wife went to the Zero Dong market to ask for food. She managed to bring home some rice, instant noodles, and vegetables. After going there twice, we heard some infected COVID-19 patients had also visited the market. Many alleys in our neighborhood were blocked, said the 53-year-old man. Since we are afraid of getting infected, we don't dare to go out. Phi, having suffered a birth defect, weighs just over 30 kilograms. Previously, he had worked as a tailor for a small company in District 1. When the pandemic first broke out last year, his company had no orders and he was laid off. He switched to work as a tricycle delivery man. His wife is also disabled and normally works as a seamstress from home. Before the outbreak, their monthly income was less than VND 7 million, around $304. The number of his customers gradually decreased as the city implemented social distancing measures. Phi and his wife used all their savings to buy 50 kilograms of the cheapest broken rice, thinking, as long as we're not hungry, that's fine. He then removed the weeds in the wasteland and planted some more cabbage. For the past 1 month, Phi and his wife's meals have consisted of nothing else. He worries they may have to beg for food should they run out of rice. Truong Van Phi and his wife in Binh Hung Ho Ward, Binh Chanh District, also face food insecurity. The only thing they could afford to stock up on was 1 kilogram of pork. Phi is blind. His wife has a serious heart disease, so her body is weak, which keeps her from working. The two have been married for more than 10 years but have no children. On weekdays, they sit together on a handicapped tricycle, selling lottery tickets. Normally, they operate around traditional markets, selling more than 100 tickets a day. But from the end of May until now, no one has shown much interest in the lottery. Along the way, they started looking for charity groups that distribute free rice. The couple has now run out of meat and eggs. These days, he and his wife often eat rice with soy sauce, with perhaps some donated boiled vegetables. With the VND 1.5 million in unemployment support they received from the city recently, Phi and her husband believe they could survive the pandemic, but their landlord dashed all hopes when he came to collect their rent, already 10 days late. Quang, a 40-year-old disabled woman from southern Anjong province, has been living in the city for 10 years. The massage facility where she and 3 other friends are working had closed down at the beginning of May. Having been unemployed for nearly 2 months and with their money and food running out, a regular customer of hers actively posted on Facebook to ask for help. After receiving enough rice, noodles, and eggs, she asked the customer to delete the post. I only have VND 127,000 left in my wallet and will avoid spending it since I still need money to buy medicine if I get sick and buy tampons. Luckily, the owner of the massage establishment has allowed us to stay here for free, she said. Over 3 months into its 4th wave, the most challenging that Vietnam has encountered, the country has recorded 153,621 cases in 62 of its 63 cities and provinces. HCMC accounts for most infections, 96,292.